Good. Well, hello, my name is Ryan Brenn. I'm a pharmacy student here at Texas Tech School of Pharmacy, and I'll be kind of walking you through some of your medications today. Are you Alex Jones, or are you picking up a prescription for Alex Jones?
Yes, I'm Alex Jones.
All right, perfect. All right, and do you know what you're picking up today?
No idea.
Okay, so you're picking up two medications, one of which is doxycycline, and the other which is your NuvaRing. And we'll just kind of start with one, and if you have any questions, just feel free to stop me and ask at any point. First one we're going to go through is your doxycycline, or as it's known as doxycin. Did your doctor tell you what this one's for?
No idea.
Okay, so on your profile it says that you've been having some problem with acne and it hasn't been resolved by benzoyl peroxide, gels, washes, anything like that. And what doxycycline is actually an antibiotic, but it can be prescribed and used for the treatment of acne. And what it does is it works to kind of kill the acne-causing bacteria, and that can kind of help relieve some of your symptoms and kind of get you to the clear skin that you might be wanting. One of the main things with this is you're going to want to take it with a full glass of water. And you're going to be taking one of these twice daily. It's a 100 milligram tablet. So when you're taking this twice daily, you want to take it in the morning and then one in the evening. You're going to be taking it with a glass of water. After you take it, you're not going to lie down for at least 30 minutes, and you don't want to break or chew or crush the tablet unless your doctor has otherwise stated. And don't take it with food either. If you miss a dose and you think about it maybe an hour after you're supposed to take it, just go ahead and take that one. But if it's coming up on the second dose and you forgot about it, you just remembered it, just go ahead and wait for that second dose. Don't double dose or anything like that. And then as far as storage goes, just kind of room temperature, away from light and moisture, so maybe not in your bathroom, and away from children if you have any of those running around your house. So one of the big things with this is people might have an allergic reaction to it. It's not very common, but if you've ever had an allergic reaction to antibiotics, you might experience itching or rash or hives, or you might even have severe stomach pain. Another thing can be liver problems, and you can tell, obviously you're not going to be able to tell something's wrong with the liver, but there are certain signs like yellowing of the skin or eyes, something known as jaundice, or if your urine appears dark in color, just go ahead and contact your doctor. And he can kind of get you moving along and make sure that there's nothing seriously wrong with that. Do you have any questions so far?
No.
So how are you going to be taking this?
Twice daily. One in the morning, one in the evening.
And can you take it with food?
Yeah.
Okay. And what do you want to take it with?
A full glass of water.
Perfect. All right. So the second one is your NuvaRing, which I see that you have been on before. So NuvaRing is also ethinyl estradiol or toninogestrel, which is just kind of a synthetic hormone, similar to what your body naturally produces, but it's used to prevent pregnancy as a contraceptive. And I'll walk you through how to insert it, because this is one of the things that kind of scares people about taking NuvaRing. It's just as effective, and it's pretty easy to do, and you can kind of leave it and forget it. So what you want to do is wash your hands first, and then remove the ring from the pouch. Make sure your hands are dry, and then kind of keep the pouch to the side, and you'll use that once you take it out to throw it away. You don't want to flush it down the toilet or anything like that. So you're going to assume a position that's comfortable for you to actually insert NuvaRing into your vagina. And what you're going to do is you're going to press the sides of the ring between your index finger and your thumb and insert it into yourself. And you're going to leave it in for 3 weeks. And then remove it once your period actually starts. And you'll leave it out for 1 week. The way that you insert this is you're going to want to insert it on day 1 of your menstrual cycle. And if you do this, you don't have to worry about effectiveness. It's good to go. But if you insert on days 2 through 5 of your menstrual cycle, what you're going to want to do is go ahead and use a backup form of contraceptive like condoms, not a diaphragm though, for 7 days, just to guarantee that it's kind of taken its full effect. With NuvaRing, you don't have to worry about pain or really it falling out, but it does happen occasionally. And if that happens and you notice it and it's been out for less than 3 hours, what you're going to want to do is rinse it with lukewarm water and then go ahead and reinsert it as I covered before. If it's been greater than 3 hours though, you're going to want to clean it with lukewarm water again, and reinsert it and use a backup form contraception for 7 days. If it's been greater than 1 week, you're just going to want to go ahead and start another one. As far as pregnancy tests go, with this, if it's been out for more than 1 week, you're going to want to go ahead and take a pregnancy test just to make sure nothing's going on. And the same thing if you miss a period, you're going to want to also take a pregnancy test just to make sure, because you don't want to be on this wall if you're pregnant or expecting. And the great thing about this is that you can stop it at any time if you do want to try and conceive a child. One of the things, though, is we saw that on your profile it says that you do not smoke. We highly recommend you do not smoke while you're taking NuvaRing. And then again, storage, just like the doxycycline, you're going to want to store it at room temperature, away from light and moisture, so not bathroom, keep it away from kids. You don't want to play with it or anything that might be a little strange. And you don't want to find a kid playing with the NuvaRing and be like, that is not a toy.
Okay.
Alright, so side effects with NuvaRing, just like a lot of these hormonal contraceptives, is you might experience some weight gain or bloating, maybe stomach pain or breast tenderness. Those are just kind of the basic normal side effects. They're not serious, but it can happen. So just be aware of that. And then one of the major things that we want to talk about is with these synthetic estrogens, which is what your body would normally be producing. Putting synthetic estrogen in the body increases the risk of a blood clot forming. And if that happens, that can be a potentially serious and even fatal side effect of this medication. So you're going to want to monitor for signs or symptoms of a blood clot. That could be anything such as shortness of breath, or chest pain, or trouble breathing, or painful breathing. So if any of those things happen, just make sure that you call your doctor, or if it seems serious, call 911 immediately and get help. And then the major contraindication with this is we don't want you smoking. So if you can avoid that, just don't smoke. It's not healthy. You just don't want to do it. So how are you going to reinsert this if it has been 4 hours after it's fallen off?
4 hours or greater than 3 hours, I need to get a new package.
Yeah, and then you'll use backup contraception for how long?
7 days.
Perfect. Alright, do you have any questions for me? Alright, perfect. Well, if you don't have any questions now, we can send you on your way and get these prescriptions filled for you. If you do have any questions, again, my name is Brenn. Feel free to call us here at the university, and we can answer any questions you might have.
Thank you.
Thank you.